Post-op instructions for extractions including wisdom teeth. First of all, bleeding. We'll have given you a gauze and we want you to bite on that gauze for up to 1 hour. And then you remove the gauze, and hopefully if you take a look, the bleeding should be mostly under control. Make sure not to spit or suck. Any of those things can cause pressure and cause the clot that you have to open up, and a bunch of bleeding can happen again. So be careful, especially not spitting. If you hear there's a bunch of saliva, you can swallow it, you can drool it, don't spit. If you do feel like there's still a bunch of bleeding, you can put another gauze and bite a little bit longer on it. Remember to keep your head elevated. Swelling, it's going to happen, but you can do a lot to help prevent the swelling from being as much as it could be. The first thing to do is to keep your head elevated for the first 2 days. That's going to help out a lot. And also to use ice for the first 24 hours. As soon as you can, start putting ice in the areas where you had that extraction happen. You put it on for 10 minutes, take it off for 10 minutes, and that's going to help a lot with the swelling. Medications, it's important to take your medications. Most of the time, if you've had an extraction, it's because you had an infection. So it's even more important to take the antibiotics we're giving to you. We also give you pain medicine. What we recommend to do is always take the pain medicine as soon as you can, because you don't know once the numbing comes away how sore you're going to be. Now, once you take the medicine, if you realize you're not that sore, you don't have to take the pain medicine. The pain medicine is just really there for you if you have severe pain. But the antibiotic, you need to take the entire cycle, because that's helping prevent the infection, or if you have an infection, helping to heal the infection as fast as possible. Eating, do not use a straw. Just as we mentioned before, spitting, sucking, those things can dislodge the blood clot. And with extractions, there's always a chance of getting a dry socket. And the best way to avoid that is to make sure you don't spit or use a straw. Now, for the first 2 days, you're going to want to eat soft and cold foods. When we talk about soft and cold, we're talking about things like ice cream, yogurt, smoothies, cottage cheese, milkshakes, jello. And for the next few months, you want to just avoid eating where you had the extraction. Just try to avoid that area. And also, don't forget to avoid spicy foods. And be careful if you're still numb, not to bite your tongue or cheek if you're trying to eat before the numbing has wore off. We actually recommend waiting until the numbing has completely worn off before eating. The only problem with that is then the soreness might have kicked in. So it's a double-edged sword, but we'll let you make that decision. Rinses. Don't do any rinses for the first 24 hours. And for anyone that has an extraction at our clinic, we prescribe chlorhexidine, which we do recommend start using on the second day. Smoking. 90% of our complications from extractions are because people smoke within the first 5 days. So do not smoke within the first 5 days if you want the extraction to heal as well as it can. Again, the tobacco from cigarettes can prevent healing, it can prevent the blood from the area, and all that is essential for a nice recovery. Activities. Avoid any strenuous activities, lifting, running, or similar activities. Avoid it for a week. Alcohol and carbonated beverages. No alcohol or carbonated beverages for 1 week. Rest. Make sure to get plenty of rest. Keep your head elevated for the first 3 nights. Pain. Pain can vary a lot on several factors, and it's hard to really determine how much pain a person is going to have after an extraction. As we mentioned, we want you to take the pain medicine right away because it could be quite severe. And if it's not so bad, you can kind of trail off and not have to take so much. But again, pain is also related depending on all the things above. If you take care of yourself and you don't aggravate it, you should heal a lot better. Going back to work depends on you. We've had crazy people that literally will go back to work the same day they had an extraction. We've had people that literally had like a lunch break and came and extracted a tooth, which is a little extreme. Most people take 2 to 3 days off. And if they had a big procedure like all their wisdom teeth taken off, they might take the entire week off. Sutures. If you had sutures placed, that means your extraction was a lot more difficult. It means there was a surgery done with your extraction. And because of that, you're going to be a little bit more sore. It's more important to follow all the post-op instructions we are giving you. Now the sutures we place in there, about 90% of the time we use resorbable sutures. What that means is those sutures will resorb. The body will disintegrate them over time. And so within 1 to 2 weeks, they'll basically disappear and dissolve. Now, if it's been a week and a half, 2 weeks, and they're still there, feel free to come back to the clinic and we'll just cut them quickly and help you with that. So basically, that's our post-op instructions. But as always, feel free to call us, write us on social media, or email us, or also check out our website where we go in much more detail about our post-op instructions.